The most deadly pandemic ever known was the Spanish flu of 1918, which broke out in Europe just as World War I was coming to a close. Makeshift hospitals were pressed into service, but couldn't stop death's rapacious march. In the end, 20 to 40 million people around the world were dead. In 1976, soldiers in Fort Dix, New Jersey, ignited fears of another pandemic. One died and others became sick with a strain of swine flu, considered to be a direct descendant of the Spanish flu.
I remember the flu of 1918-19. I was a small child, but I remember it. We buried 3 in 1 week from one family.
U.S. President Gerald Ford put the nation on alert.
No one knows exactly how serious this threat could be.
Ford ordered everyone in the country to be inoculated. Millions got in line to get their shots, but things went wrong. More people died of the vaccine than of the flu itself. The pandemic never materialized, leaving Americans deeply distrustful of government health policies.
To deal with SARS?
Then came SARS in late 2003. Originating in China, the virus quickly flew around the globe. It was a virus never seen before, and it stunned the medical community.
This is not a typical pneumonia.
Toronto was the Canadian epicenter. Hospital patients were quarantined. Officials were unprepared. Globally, there were 8,000 suspected cases and 774 deaths. 44 of them were in Canada. As a result of SARS, Ottawa set up the Public Health Agency of Canada. The next year, in 2004, avian flu flared up in China, where humans and poultry subsist closely side by side. Hundreds of thousands of birds were destroyed to try and stop the spread. So far, there is no pandemic, although avian flu is still circulating in poultry in many countries. Officials say Canada is now much better prepared. Vaccines are stockpiled along with protective gear, and plans are in place to fight another pandemic should one be on its way. Joan Leishman, CBC News, Toronto.